Good evening, ma'am. We can start, ma'am.
Good evening. Good evening, Shivang. Good evening, sir. Am I audible?
Yes, ma'am. You are audible, ma'am.
Good evening, sir. Thank you, Shivang. Good evening, sir.
Yeah, good evening. How are you?
Fine, sir. Thank you. Very good evening to all my seniors, all AHD members, and today's speaker, Dr. Rajiv Jain, sir. It's my pleasure to meet you all once again on this platform. I'm Dr. Sushma Trivedi, pediatrician working at NHPC and executive committee member of AUHD Delhi branch. I think first of all, let me actually, I think first of all, let me actually say that it's wonderful today being a part of this webinar because this session is going to be a very interesting and very informative session, as sir has already given so many webinars on this topic. We all are interested and looking forward to such type of webinar, which is based on occupational health issues day by day we are facing in our workplaces. And these webinars giving us lots of current and correct information about occupational health and its related issues. Dr. Rajiv Jain sir is better speaker and to speak on this topic. I can say him guru in the field of occupational health. Sir, I salute and admire you and really appreciate you for your hard work in this field. Now, come to the topic. So today's topic is the monthly updates on environmental and occupational health issues, local, regional, and global. Also, sir will show us some light on breastfeeding supports in workplaces. As we know, IAP is going to celebrate Breastfeed Week from 1st of August. Without wasting a time, now I will introduce Dr. Rajiv Jain, sir. He is a Vice President of AUHD, Delhi branch. Sir has done MBBS from Maulana Azad Medical College, also done DCH and MD, DNB in health administration, including hospital administration. He has done diploma in Chinese language from Delhi University. Sir is a senior consultant health in Indian Railways, New Delhi, and he has 40 years of experience in health and hospital administration. He has received Fellow Award of Indian Public Health Association, Fellow Award of Indian Association of Occupational Health, Fellow Award of Association of Environmental and Occupational Health Delhi. He has presented and published more than 145 scientific papers in national and international. Sorry, I'm not audible. Okay, he has presented and published more than 145 scientific papers in national and international conferences, journals, and books. Sir has received fellowship scholarship by WHO, National Institute of Health, USA. He is a member of disaster management in Ministry of Railways, Government of India. Sir has received many awards in many fields, which shows his tireless and continual hard work. Now I'm inviting Dr. Rajiv Jain, sir, to speak on this topic. Thank you, sir.
Thank you, Dr. Sushma, for the nice word that is spoken. I do not know how much I deserve what you said.
Sir, you are deserving.
So today's episode of OCU Healthscapes, which is a video magazine on environmental and occupational health issues, is the 20th issue, which means for the last 20 months, every month, once a month, last Saturday at 6:30 p.m., we collect to actually update ourselves on the issues of environmental and occupational medicine, whether it is regional or it is local or national or international. And we try to update our knowledge so that we keep not only updating our knowledge, we also think of doing further improvement in our practice of occupational health and environmental health in the workplace that we practice in. So today's episode is special. As Dr. Sushma has mentioned, the world will be celebrating the World Breastfeeding Week from 1st of August to 7th of August. Every year, from 1st of August to 7th of August, the world celebrates, and India will also celebrate all the workplaces will also celebrate the World Breastfeeding Week. Normally, we have special days by the World Health Organization or UNICEF, but breastfeeding is so special that WHO, UNICEF, and the entire world community celebrates a whole week, whole 7 days for breastfeeding. We shall consider breastfeeding at workplace as an important aspect for discussion today. In addition, we shall also take a look at the eShram portal. What is the dashboard saying? We should also review the progress made in the labor codes that Government of India has enacted in the Parliament of India, and it has received assent of the President of India, but it requires approval of the legislature of all the state legislatures in the country, because labor is in the concurrent list in the Constitution of India. We should also see what are the forthcoming conferences, webinars, whether international or national, that are scheduled to be organized in the next few months, so that you could attend any or all of them if you want to have an updation or want to improve your knowledge in a certain aspect of occupational health. But before we move forward, I would like to share with you a video by Dr. Tedros from the World Health Organization, the DG of the World Health Organization, the most important event in the last 1 month, the declaration of public health emergency of international concern by the World Health Organization. Let's listen to him.
We have an outbreak that has spread around the world rapidly through new modes of transmission, about which we understand too little and which meets the criteria in the international health regulations. For all of these reasons, I have decided that the global monkeypox outbreak represents a public health emergency of international concern. I have made a set of recommendations for 4 groups of countries. First, those that have not yet reported a case of monkeypox or have not reported a case for more than 21 days. Second, those with recently imported cases of monkeypox and that are experiencing human-to-human transmission. This includes recommendations to implement a coordinated response to stop transmission and protect vulnerable groups, to engage and protect affected communities, to intensify surveillance and public health measures, to strengthen clinical management and infection prevention and control in hospitals and clinics, to accelerate research into the use of vaccines, therapeutics, and other tools, and recommendations on international travel. The third group of countries is those with transmission of monkeypox between animals and humans. And the fourth is countries with manufacturing capacity for diagnostics, vaccines, and therapeutics. Although I'm declaring a public health emergency of international concern, for the moment, this is an outbreak that's concentrated among men who have sex with men, especially those with multiple sexual partners. That means that this is an outbreak that can be stopped with the right strategies in the right groups. It's therefore essential that all countries work closely with communities of men who have sex with men to design and deliver effective information and services, and to adapt measures that protect the health, human rights, and dignity of affected communities. With the tools we have right now, we can stop transmission and bring this outbreak under control.
So you've heard what Dr. Tedros said during the declaration speech that he gave about 6 days back, declaring monkeypox as the public health emergency of international concern. The second video I would like to share with you is regarding the COVID-19 variants that are evolving very fast all over the world. Let's listen to Dr. Maria van Kerkhove.
We are seeing an increase, a continued increase in case detections of COVID-19. It's the 5th or 6th week in a row where we're seeing increases in the reported numbers of cases. Omicron, the latest variant of concern, is dominant worldwide, and there are many subvariants, sublineages of Omicron that are currently circulating. About half of the sequences that have been shared in the last 4 weeks or so are BA.5. one of the sublineages, and there are even further sublineages of BA.5. So this virus continues to evolve. This is driven by a number of factors. It's driven by intense mixing of individuals in the absence of mitigation measures, in the absence of wearing masks and distancing. Deaths are also increasing, and deaths have been increasing for the last 5 weeks. This is driven by some groups that are not well protected with the vaccine, meaning they have not been vaccinated, or they have not received the full number of doses that are required for them. Almost half of the deaths that were reported in the last week were from the Americas, and about 33% of those deaths were in Europe. And among the top 50 countries that have had reported increases in deaths, 35 countries had more than a 100% increase in deaths reported in the last week. 3 countries had more than 1,000% increase in deaths in the last week. It's not the trends that we want to be seeing right now. Our good news is that our interventions continue to work against all of the variants, all of the subvariants as well. We just need to consistently apply them, and we need to consistently use them, really focusing mostly on vaccinating those who are most at risk, but also using other measures to lower your risk of infection. Masks and distancing, improving ventilation, working from home if unwell. These recommendations are still in place. Doesn't mean that you can't live your life, but we want people to do it a little bit safer.
So now you know what you have to do to maintain your health and protect yourself from 2 of the most important global infections, that is monkeypox and COVID-19. And you have to continuously keep doing it and ensure that people in your organizations also keep protecting. So please share the contents of these 2 videos with your workplace managers as well as workers. So now we go to the core issue of today, the major highlight of today's discussion, that is the World Breastfeeding Week. And the occupational health physicians have to know how to support breastfeeding in the workplace. And this is the global guide for employers that I shall be sharing with you, the global consensus on what needs to be done to support breastfeeding in the workplace. Breastfeeding is key to the comprehensive development of children for mothers and society. Family-friendly policies enable parents and caregivers to provide the best start in life for their children. They pay off in healthier, better educated children, a better equipped workforce, and lead to sustainable growth. Family-friendly policies help workers to reconcile work and family responsibilities and advance the well-being and development of their children. UNICEF has identified 4 major policy areas to children's well-being, women's empowerment, and the provision of decent work for caregivers. Sufficient paid leave to all parents and caregivers in both the formal and informal economies to meet the needs of their young children. This includes paid maternity, paternity, and parental leave, and leave to care for sick young children. Second, support for mothers to breastfeed exclusively for the first 6 months of life, as per World Health Organization and UNICEF recommendations, and to continue breastfeeding for as long as they choose. The third, ensuring that all children have access to affordable, good quality childcare and early education. Fourth, providing child benefits and adequate wages to help families provide for young children. These policies provide the parents and caregivers with the essential time, resources, and services needed to recover from giving birth and to ensure secure bonding and attachment with their newborns, create a foundation for lifelong health. Breastfeeding is the natural and healthiest way to feed a baby from birth. No milk substitute can compete with breast milk in terms of nutrients, antibodies, attachment prospects, bonding, and stimulation. The advantages of breastfeeding manifest themselves right from baby's first contact with the mother's breast and benefit the baby, its mother, and the relationship between the two. Ideally, babies need 6 months of exclusive breastfeeding that is without other liquid foods and should therefore after continue breastfeeding with the addition of other foods until the age of 2 or older. Employers play a critical role in supporting families and enabling women to continue breastfeeding for as long as they choose. What are the benefits for the company? Supporting breastfeeding in the workplace has significant human and economic benefits. I have listed 5 of them. First, improving the corporate image of businesses, showing that they care about the health and well-being of working women and their families. Second, reducing the amount of leave requests made to attend doctor's appointments for both mother and child, as well as the amount of sick leave. Third, reducing maternity-related absenteeism, which can translate into 30 to 70% fewer absences. Fourth, increasing the retention of female workers as they feel more supported by the company. And fifth, reducing the employee turnover rates and saving the company money by eliminating the need to hire and train new staff. The implementation of a breastfeeding room or space creates greater job satisfaction because it facilitates greater balance between breastfeeding and work. It also helps breastfeeding women feel more at ease during working hours and in their lives generally. It also increases breastfeeding women's sense of belonging and commitment to the company. It also increases working women's performance as they feel more motivated and content to carry out their duties. Helps employees to return to work after maternity leave and reduces leave for childcare. It also allows women to combine work with motherhood in the form of continued breastfeeding. And last but not the least, it shows that staff are recognized, respected, and supported as mothers and fathers. What are the benefits for the mother and child? I've listed 3 of them. Breastfeeding substantially improves the health of a mother and her child. Second, breast milk protects the child from infectious diseases such as diarrhea and respiratory infections, thereby reducing the frequency or severity of common childhood illnesses. And third, studies have proven the fundamental role of breastfeeding in preventing non-communicable diseases such as obesity, being overweight, hypercholesterolemia, type 2 diabetes, and cardiovascular diseases. It is one of the practices that help prevent sudden infant death syndrome. For the mother, it encourages a speedy recovery after delivery as it prevents heavy bleeding. It also reduces risk of chronic diseases such as breast and ovarian cancers, heart disease, and diabetes. It also improves birth spacing. From breast milk, the child receives all the nutrients needed at the right quantity and temperature as it adapts to the needs of the child throughout his or her growth and development. Breast milk has bioactive components which cannot be reproduced, so baby formulas or other milks which have significantly different compositions cannot be used as a substitute. It is therefore very important that once a mother returns to work, her child continues to be breastfed. If in its first 6 months, a baby is fed some other form of food, it may adversely impact its health and growth. as well as reduce the amount of breast milk consumed. What are the benefits for society and the environment due to breastfeeding? I've listed 3 of them. Breast milk is always available and within the reach of any economy. It offers advantages that cannot be replicated by any other food. However, breastfeeding practices are often adversely affected by variables such as the inappropriate marketing and promotion of breast milk substitutes and a lack of support systems in the workplace. Breastfeeding encourages family savings, as there is no need to spend money on purchasing formula as well as savings on medical costs as children get sick less. Third, breast milk is a natural, renewable, and sustainable resource which does not generate waste nor pollution. An exclusive and equipped area for mothers to breastfeed their children, express milk and store it properly is required. Breastfeeding rooms, what are the rights and obligations? Employers have a responsibility to ensure safety for women in the workplace, free from environmental hazards. They should also prohibit discrimination in the workplace on the basis of pregnancy, breastfeeding, or family status. Businesses should ensure the monitoring of workplace discrimination. What is a breastfeeding room? It is an exclusive and properly equipped area for mothers to breastfeed their children, express milk, and store it. What are the rights and obligations? As a minimum, employers need to comply with any existing legislation on maternity leave and workplace breastfeeding support. UNICEF recommends at least 18 weeks maternity leave, striving for at least 6 months of paid maternity, paternity, and parental leave after the birth of the child that is available for both parents to promote and support exclusive breastfeeding. Workplaces should be in accordance with ILO Maternity Protection Convention 2000, number 183, Article 9, which says a woman shall be provided with the right to 1 or more daily breaks or a daily reduction of hours of work to breastfeed a child. And also the period during which nursing breaks or the reduction of daily hours of work are allowed, their number, the duration of nursing breaks, and the procedures for the reduction of daily hours of work shall be determined by national law and practice. These breaks or the reduction of daily hours of work shall be counted as working time and remunerated accordingly. Employers should arrange training for managers on the benefits of breastfeeding in terms of higher employee retention, lower turnover costs, health benefits for the child and mother, and lower absenteeism due to a child's illness. Breastfeeding rooms must provide adequate space and privacy, accessibility, furniture, supplies, lighting, ventilation, and hygiene. Business leaders and their networks should act jointly with governments and civil society actors to raise awareness of the benefits of breastfeeding and family-friendly policies for children's health and development. What should a breastfeeding room include? A breastfeeding room should be a clean, comfortable, safe, and a private space for women. The main function is for mothers to effectively express and store milk during working hours. It should also offer comprehensive and culturally appropriate breastfeeding support to employees, which includes breaks, private space, and lactation counseling support and education services with an assigned coordinator to help with access, planning, and oversight. And you see the structure on the left, you find comfortable armchair in an upright position made of washable material. Then you have a power outlet. Also, you have a storage system at least 20 centimeters from the floor. And besides that, you have a waste bin. Paper towels are also available. Wash basins inside the breastfeeding room or within a 10-meter radius is also there. Then there is a soap dispenser. And on the right, you find easy access and access controls. So this is what the breastfeeding room has. Now we go to lactation location, accessibility, and privacy. The breastfeeding room should be located in a physically separate area with direct access away from the restrooms, but close to the workspace. It must also ensure privacy, so enhanced entrances must therefore be closed properly, and the facilities must be designed to ensure that mothers using the room are not visible from the outside. It is suggested that the space should be fully available during the workday and that clear signages be placed inside and outside the room. It is necessary to take into account the location of the space to maintain its distance to areas where toxic substances are handled or waste is deposited, how much time to get to the room, and other observations that are considered pertinent can be applied. The lactation room should have exclusive access control for breastfeeding women and cleaning staff. This can be done by putting a manual lock on the door or installing an electronic access control system and using an occupied signage, that is. Breastfeeding support during COVID-19 is also important. As you know, we are still in the pandemic phase of COVID-19. Additional hygiene measures should be taken into consideration during COVID-19 when it is vital for employers to provide guidance and training on occupational safety, health measures, and hygiene practices. There is a UNICEF, ILO, UN Women key steps employers can take. This is the document which you can access. More information on encouraging and supporting working mothers to continue breastfeeding can be obtained from UNICEF guidance and WHO FAQs. Mother and infant while breastfeeding should maintain a distance of at least 1 meter from other people, and the mother should avoid touching her eyes, nose, and mouth. Women should be advised to wear a mask while breastfeeding, wash their hands with soap before touching the baby, wash breast milk pumps and milk storage containers after every use, and routinely clean and disinfect the surfaces they touch. Where possible, breastfeeding rooms where women can express milk should be kept clean and equipped with disinfecting wipes, a trash bin with a lid, hand sanitizer, and hand washing facilities. Common areas, including breastfeeding rooms, should be cleaned more often, as should repeatedly touched surfaces, for example, door handles and elevator buttons. Education leaflets should be distributed, and training where necessary should be given to workers to support occupational safety and health measures. Hygiene practices and other measures to protect themselves, their families, and communities. Posters can be displayed on walls with prevention and protection advice. Messaging should follow WHO advice for the public. Employers should adhere to the International Code of Marketing of Breast Milk Substitutes and subsequent World Health Assembly resolutions, including World Health Assembly 69.9 and the associated WHO guidance on ending the inappropriate promotion of foods for infant and young children. That you can find at the UNICEF website, where UNICEF Global Nutrition Cluster and GTAM Infant and Young Child Feeding Brief. This is a document which is freely accessible. What should be the furniture and the supplies? Ideally, the breastfeeding room should have hand washing facilities and necessary supplies such as drinking water, liquid soap, dispenser, hand sanitizer, cleaner for surfaces, and paper towels. The tap should also be able to dispense water hands-free, that is automatically. In order to preserve the breast milk until the mother takes it and feeds it to the child, it is necessary to have a cold storage system available, which should preferably be a freezer or fridge for the exclusive use of the breastfeeding room. This equipment must be at least 20 centimeters from the floor to ensure that it is hygienic. The room must have a comfortable chair, such as an armchair, preferably an individual seat, rather than a sofa with adjustable height and good back support. This must be made of a material that allows it to be easily washed and disinfected. Direct or indirect advertising or promotion, posters, objects, gifts, infant formula sample, information addressed to women and families of companies manufacturing, distributing, or marketing breast milk substitutes in any way is prohibited in compliance with the International Code of Marketing of Breast Milk Substitutes. Lighting, ventilation, and hygiene, that is also important. Lighting and ventilation are important elements in creating a warm and comfortable environment. Hygiene is essential for the management of breast milk. Efforts should be made to ensure that all breastfeeding activities can be carried out in a normal and safe manner. Natural light is preferred, but this is not possible due to the constraints of the space. If it is not possible, then suitable artificial lighting, ventilation, and heating must be provided. The use of air conditioning is recommended to maintain suitable temperatures. Cleaning should be done with odorless, food-safe products used exclusively in the breastfeeding room. If necessary, a cleaning protocol prepared by the Ministry of Health is available. Furniture in the breastfeeding room should preferably have smooth surfaces, and any material that cannot be washed, carpets, fabric, curtains, or other elements that attract dust should be avoided. Ceilings, walls, room dividers, and floors should ideally be smooth without dirt accumulation points and easily washed and disinfected. There should also be a countertop or table for holding the breast pump if a mother is using such pump and other supplies. A pedal-operated waste bin, preferably plain and made of stainless steel to enable better disinfection. Routine daily maintenance to ensure hygienic and safe environment. Outlets for all electronic devices with those intended for electric breast pumps located close to the armchairs. A clock, coat rack, hooks, and a full-length mirror to help check and readjust clothing before returning to work. Now we talk of optional facilities. Some aspects of breastfeeding rooms are not required by law, but they help to encourage and support mothers at this very important stage of their lives. These include a library with books, guides, brochures, and posters containing information on pregnancy, early childhood, and breastfeeding, among other related topics. For hygiene reasons, this library should be private and enclosed. Artwork, soft lighting, and bulletin board. Second chair and footrest to ensure comfort while breastfeeding. Consider inviting mothers to help design the breastfeeding room or provide a comment box to allow mothers to offer suggestions on modalities of improving the room. Providing a breast pump, even if it is not a formal requirement. Supplying nursing pads, breastfeeding gel packs, as well as glass containers or bottles with plastic lids into which to transfer the expressed milk. Now, having learned all what should be done and how a breastfeeding room should be organized, let's look at the case studies in certain countries in the world and what unique way of ensuring breastfeeding as workplace they did. Let's first look at Uruguay. In Uruguay, 35% of companies have a breastfeeding room on their premises, and 76% allow their employees to leave their workplace to breastfeed or express milk whenever they need to. The headquarters of one company opened a breastfeeding room as a result of joint initiative of the union representatives and the company. In addition to this, it provides temporary breastfeeding spaces in its medical facilities when required. Being able to provide mothers with support, space, and peace and quiet at this stage of their life and helping to make their return to work as easy as possible has been a positive change for the company. In the words of a social responsibility coordinator, for women, breastfeeding at work implies harmonization of their personal and professional lives. Having that support space in the company ensures that those using the room feel more content in their return to work. Let's look at an example of Bangladesh. Mothers at Work is a national program developed to ensure maternity protection and breastfeeding support in the workplace. The UNICEF Bangladesh country office is facilitating the national initiative by promoting breastfeeding practices among mothers working in the ready-made garment sector in partnership with public, private, and civil society organizations. The Mothers at Work program has now reached 92 factories and around 160,000 workers and their young children. This has led to improved environment to support working women, knowledge on the benefits of breastfeeding among pregnant working mothers, breastfeeding practices among working mothers, and productivity in the workplace. In a private tea plantation in Kericho, Kenya, an innovative baby-friendly workplace initiative is supporting mothers as they return to work. Workplace intervention, the tea plantation focus on disseminating baby-friendly workplace policies, sensitizing managers, supervisors, and employees to the issue, and equipping the social welfare team to facilitate access to workplace support. Daycare centers were also established, promoting safety, hygiene, and play, and providing breastfeeding rooms for mothers. In Kenya, in 2017, the Kenyan Parliament passed a health act which requires all employers to establish breastfeeding stations with the necessary equipment and facilities, to take strict measures to prevent any direct or indirect promotion, marketing, or selling of infant formula and or breast milk substitutes in breastfeeding stations, and to grant all breastfeeding employees paid breaks in addition to regular time off for meals, breastfeeding, or breast milk expression for up to 1 hour of every 8-hour work period. UNICEF played a key role in advocating for this act in partnership with the Ministry of Health and the Kenyan Private Sector Alliance. In Vietnam, clothing and footwear is one of the largest export sectors in Vietnam. The majority of this sector's 3.5 million workforce are women of reproductive age, of whom an estimated 60% have children. Here, exclusive breastfeeding rates among working women are especially low. Due to the challenge of continuing breastfeeding while working, as well as active misinformation campaigns by formula companies targeting working mothers, the Vietnam Chamber of Commerce, the Ho Chi Minh City authorities, and the clothing sector coordinated a program for migrant families and breastfeeding mothers, which has reached 74,000 workers so far, increasing breastfeeding awareness and support and implementing childcare measures in 11 workplaces. Committed companies is also an important aspect. In addition to installing suitable breastfeeding room, how else can the company help? 3 ways I've listed here. Commit to an enabling breastfeeding environment at work, supported by the highest level of company management. Second, raise awareness of staff on the importance of breastfeeding through training and information policies. And third, help mothers to continue breastfeeding by offering options such as flexible schedules, part-time work, or working from home. Why should a mother frequently express milk? A breastfeeding woman needs to express milk as often as she would breastfeed the baby. That is, every 2 to 4 hours, depending on the child's age. At this frequency, the woman feels comfortable, relieved, and content, and can perform better at work without feeling tired or in pain, optimizing her productivity. Frequent expression also encourages a mother's production of milk, as from a physiological point of view, her amount of milk basically depends on stimulation, with a reduction in expression, therefore, having a negative effect on this production. How long will a woman need at work to express her milk? Expression time varies for each woman, although it is possible to determine an average of between 15 and 20 minutes, particularly during the first 6 months of the baby's life. Expressions are necessary every 2 to 3 hours, depending on an individual's woman's body and physiology. So now you know what needs to be done as a global best practice in the workplace to promote breastfeeding. So kindly disseminate, share these best practices amongst your management and your employees so that your workplace becomes better and more child-friendly, more mother-friendly workplace. And breastfeeding ensures future of the society. Now, we go to the previous slide, please. This is the dashboard that I have taken a few hours back from the Ministry of Labor and Employment, Government of India. This is the eShram, that is Shramev Jayate portal, eShram portal. Yesterday, 43,375 registrations were done. Total 28 crore 3,69,000 registrations have been completed. And what are the top 5 states? Number 1 is Uttar Pradesh with 8 crore 29 lakh, Bihar with 2 crore 83 lakh, West Bengal with 2 crore 55 lakh, and Madhya Pradesh with 1 crore 63 lakh, and Odisha 1 crore 32 lakh. Now you know where from the workers migrate. These are the top 5 states. What are the top 5 occupation sector? Number 1 is agriculture with 14 crore 65 lakh. Second is domestic, that is 2 crore 76 lakh. Construction is third, that is 2 crore 55 lakh. Apparel is 1 crore 75 lakh. Miscellaneous are 1 crore 19 lakh. And you can see where they are going. CSC, self, state, and Umang application is the mode of registration. Number 1 is Common Service Center, where 17 crore registrations and self-registration by 10 crore workers have been done. 28 crore, great achievement in such a short time of the e-Shram portal. The entire package of welfare and health measures and social protection will be done through this portal. Next slide, please. As you know, the government enacted 4 labor codes, namely the Code on Wages 2019, the Industrial Relations Code 2020, that is the IR code, or the Code on Social Security 2020, that is SS code, and the Occupational Safety, Health and Working Conditions Code 2020, that is OSH code. Labor as a subject is in the concurrent list of the Constitution of India. And under the codes, the power to make rules has been entrusted to central government as well as state governments. As a step towards implementation of the 4 labor codes, the central government has pre-published the draft rules, inviting comments of all stakeholders. The details of the state and union territories which have pre-published the draft rules, inviting comments of all stakeholders are now, on the left are the 4 labor codes, and at the bottom is the Occupational Safety, Health and Working Conditions Code 2020. And on the right are the name of the states which have pre-published the draft of these labor codes and the rules. Let's look at the Occupational Safety and Health and Working Conditions Code 2020. Which are the states? Andhra Pradesh, Arunachal Pradesh, Assam, Bihar, Chhattisgarh, Goa, Gujarat, Haryana, Himachal Pradesh, Jharkhand, Karnataka, Kerala, Madhya Pradesh, Manipur, Odisha, Punjab, Tamil Nadu, Telangana, Tripura, Uttarakhand, Uttar Pradesh, Union Territories of Chandigarh, Jammu and Kashmir, and Ladakh. Total 24 states. And the Code on Wages 2019 by 31 states. Industrial Relations Code by 26 states. And the Code on Social Security by 25 states. And this is the statement which the Minister for Labor and Employment gave on the floor of the House on 18th of July 2022. Next slide, please. The labor code strengthened the protection available to workers, including unorganized workers, in terms of statutory minimum wages, social security, working hours, healthcare, etc. The SS Code 2020 provides for social security benefits for all workers, including in unorganized sectors, as well as gig and platform workers. Some of the new provisions envisaged in the codes are as under: 1. Setting up of social security fund for formulating schemes of welfare of the unorganized workers, gig workers, and platform workers. 2. Extension of coverage under Employee State Insurance Corporation, ESIC, to pan-India, that is, in all districts in the country. 3. ESIC coverage on voluntary basis for establishment having less than 10 employees has been introduced. 4th, benefits under ESIC can also be made applicable through notification to an establishment which carries on hazardous or life-threatening occupations in which even a single employee is employed. 5. Extension of benefits to unorganized workers, gig workers, and platform workers, and the members of their families through ESIC or Employees Provident Fund Organization, that is EPFO. And 6, for the person engaged in fixed-term employment, that is FTE, the proportionate benefit of service has been extended without requirement of minimum service of 5 years for gratuity. The person having a contract for 1 year under FTE will also be eligible for gratuity. So these are path-breaking changes which India is making as a federal organization. The central government and the state government together are doing it a revolution in looking after the safety, health, and social security of the workers, whether in the organized or unorganized sector. And this is the best way to celebrate 75 years of India's independence. So Azadi Ka Amrit Mahotsav is celebrated best by looking after the people who work for the country at the grassroots level. Now we go to the last segment of this OcuHealthscapes, that is the webinars and the conferences that are scheduled in the next few months at the international level or the national level. First is on 17th August 2022. This is a webinar organized in Sao Paulo, Brazil, Buenos Aires, and Argentina. Telework, a decent work. This is organized by International Commission on Occupational Health and International Ergonomic Association. This is sponsored by the Brazilian Ergonomics Association, that is Abergo, and sponsored by USP, UFRJ, UFRGS, APMT, ULAERGO, and several ergonomics associations of Latin American countries. Topics will be telework, decent work. The webinar will be held in Portuguese and Spanish languages. So you can see the website abergo.org.br and /eventos. This is the flyer for the webinar. You could log in and you can register and watch this on 17th of August, 2022. Next is a hybrid event, which you could attend online if you are not going to Odense in Denmark. It is on 23rd August 2022. That is Public and Occupational Health and Sustainable Agriculture. It is organized by International Commission on Occupational Health, Scientific Committee on Rural Health, DASAM, and Odense University. Odense University Hospital and University of Southern Denmark and DASAM are sponsoring this webinar. Topics will be surveillance, diagnosis, and prevention of occupational diseases and injuries, musculoskeletal disorders, pulmonary diseases, stress and other psychological distress, exposure hazards, and toxic effects of hazardous substances, pesticides, and others, cancer, hearing loss, infections, COVID-19 and zoonosis, health issues specifically affecting women and children, reproductive health and child labor, community health, effects of air pollution, pollutants, and other exposure to hazardous substances in agriculture communities and among consumers, and also climate-wise agriculture. The website address is written down there, DASAM PK Agri OHS 2022. Agri OHS 2020. This is the part of the brochure, Public and Occupational Health in Sustainable Agriculture, a one-day hybrid event on August 23, 2022. You can see the event is aimed at junior and senior researchers, occupational health practitioners, agronomists, occupational industrial hygienists, and managers and specialists, social security managers, and representatives from governmental departments, regulatory bodies, employers, employees, unions, industry, academic institutions, and professional societies. And this is a hybrid event. So, and I've given you the registration link. These are the supporting partners. A wide range of supporting partners are organizing this event. This is the schedule of this one-day event, and you can see what wide-ranging topics are there: farm dust, lung disease, mental health, ergonomics, climate changes, collapse of the Dutch agriculture miracle, accidents, how to organize inspection in agriculture, safety and prevention in agriculture, ISSA agriculture, Vision Zero, One Health in dairy industry, challenges and future of agriculture in low and middle income countries, pesticide exposures and health consequences with a focus on LICs. Then there is a free webinar on mental health at work on 7th of September, 2022 from 9 a.m. UK time. And this is free. Just go to the Society for Occupational Medicine website, som.org.uk. We continue on the previous slide, please. Yes, this is exclusive webinar on mental health at work, and it pays to care report. Dr. Mary Wyatt, it pays to care, will be speaking for 25 minutes. Then Professor Neil Greenberg, Professor of Defense Mental Health, King's College London, on mental health at work, will be also presenting for 25 minutes. Then Dr. Shriti Patani, President of Society for Occupational Medicine, the role of occupational physician in acute hospitals and the NHS growing OH program, 20 minutes. So this will be the schedule, and it will be in partnership of Society for Occupational Medicine UK in with New Zealand and Australian Society for Occupational Medicine, and it's completely free. From 21 to 23rd September 2022 in Kampala, Uganda. Third MINOSH, that is Mining, Occupational Safety and Health International Conference, will be organized by the International Commission on Occupational Health Scientific Committee on Mining, Occupational Safety and Health, that is MINOSH. Topics will be the role of health professional education in strengthening health systems research, global and community health for economic development. As that submission deadline is already over, you could go to the website chs.icpsr.org.uk mak.ac.ug/JASS 2022. This is a part of the brochure. 16th Joint Annual Scientific Health Conference, 28th UN ACOH Conference, 3rd Minosh International Conference, and 20th Dr. Matthew Lukebia Memorial Lecture. Theme is you already there, and you can see the sub-themes on the left. And the rates also are mentioned. This is the payment and sponsorship details. Now, next event is online webinar on 24th October, Understanding the Transition from Work to Retirement, organized by ICO Scientific Committee on Aging and Work in collaboration with Omega Net Cost Action. Topics will be, the following topics will be discussed and introduced by 3 experts in the field of transition to retirement. 1, a conceptual framework addressing the complex labor market dynamics of the work to retirement process by Taina Linonen, FIOH Helsinki. 2nd, conceptualization of healthy working life expectancy by Svetlana Soloviva of FIOH. And 3rd, the role of health in the transition from work to retirement by Hans Martin Hasselhorn, University Wuppertal, Germany. And if you want to attend, just email to karin.proper, PROPER, @rivm.nl. 28th April to 3rd May 2024, Marrakech, Morocco, on-site Congress, ICO 2024, Enhancing Occupational Health Research and Practice, Closing the Gaps. That is the theme. Organized by ICO, Moroccan Occupational Health Association, MOHA, Faculty of Medicine and Pharmacy of Casablanca, Hassan El University of Casablanca. Website is coming soon. OccuCon 2023 in New Delhi at Constitution Club of India, New Delhi, from 18th to 21st of January 2023, with a theme, Workplace Health, Wellbeing and Environmental Sustainability for Future Ready Organization, shall be organized at the center of the country, that is Constitutional Club of India, very near the new Parliament and new Central Vista and the President and Parliament House, walking distance. The theme is, as I told you, workplace health, well-being and environmental sustainability for future ready organizations. These are the conference sub-themes, and you can see a very, very wide range of conference sub-themes are there, right from accident prevention, aging and work, allergy and immunotoxicology, disaster management and emergency preparedness, education training, emergency preparedness, epidemiology and occupational health, ergonomics, women health and work, industrial hygiene, work and vision, work organization, psychosocial factors, integration of quality with OHSE, integrated management system, indoor air quality and health, integration of occupational health with primary health care, legislative aspects of OHSE, learning from best practices, mindfulness and stress in management workers, mining occupational safety and health, musculoskeletal disorders, neurotoxicity and psychophysiology, occupational and environmental dermatosis, occupational cancer, occupational health nursing, occupational medicine, occupational toxicology, occupational health and CSR, occupational health and development. And also the list goes on. Next slide. Occupational health for healthcare workers, occupational health in chemical industry, that is Medicam, occupational health in construction industry, promotion of mental health, including work-life balance, radiation in work, reproductive hazards in the workplace, respiratory disorders, rural health, agriculture, pesticides and organisers, safety culture, behavior-based safety and accident prevention, shift work and working time, small-scale enterprises and the informal sector, thermal factors, toxicology of metals, unemployment, job insecurity and health, vibration and noise, women at work, history of prevention of occupational and environmental diseases, integrated approach to occupational health, hygiene, safety and environment, work disability prevention and integration of occupational health with workplace wellness program, quality of life and lifestyle issues. Such is the wide range of topics that will be covered in OccuCon 2023 New Delhi from 18th to 21st of January 2023. Next slide. This is the Delhi registration fees. IOH member is 15,000 at the moment till 31st August. Non-IOH member is 19,000. If you become IOH member, you could do it combined at 22,000 rupees. Retired IOH member above 65 is just 6,000. Accompanying person is 6,000. PG students is only 3,500. And professional development course is just 6,000 rupees per PDC. These are the rates up to 31st of August. These are the areas where you could attend the conference, attend the workshop and exhibition. This is the contact details. The website is also there, and the phone numbers and email ID is also written. Occupon.com, just Google Occupon.com and you will reach this website of Occupon 2023. Next event that we want to share is EPICO 2023, Mumbai, India. Indian Institute of Occupational Health Mumbai branch and the Tata Memorial Center are hosting from 14th March pre-conference, ACTRAC Kargar, Navi Mumbai, main conference of 15th to 17th March at Tata Memorial Center, Mumbai. Theme and topics are written on the right. These are the early bird registration rates and full rates on the right side after 31st of January 2023. You can see for Indian and international delegates, ICO and IOH members, 15,000 rupees, and from LMIC countries, ICO member $350 US, ICO or IOH members 18,500 rupees, and you can see the non-ICO members 22,500 rupees. Student and early career researchers only 11,500. So now we come to the end of today's 20th episode of OcuHealthscape, the monthly video magazine on updates on environmental and occupational health issues. So next month's, that is August episode, will be the 21st episode on 27th of August 2022, right at 6:30 p.m. So do come back for the next episode. Thank you so much for attending this session and listening and giving your attention. Thank you so much.
Thank you, sir. It was really very interesting, and you had given lots of information. I cannot say how much it was, and very informative session. I think this topic was very important to understand, especially in the current scenario, COVID-19 scenario, especially for the breastfeeding, what you have told about the breastfeeding. I think being a pediatrician, I can say a few words about the breastfeeding. It is really very important thing for so many, not only for the children, for adult life, for all age group. Like it is very important for the workplaces. Even government has given lots of program, national and international program based on the breastfeeding, which are definitely promoting breastfeeding and help in implementation, how to give, how to promote it, the correct way to give breastfeeding and all. So breastfeeding is a very important for not only for the physical growth, for the mental growth, social well-being for the children as well as mother. And it as you told, it increases the immunity. So it is very helpful for the whole life, not only for the pediatric age group. So we should focus on this. It's a very important thing. And you have given lots of information, so no need to extend this. And really very thank you, sir. I can see Dr. Kamla ma'am, Vice President AUHD, she's there. So I welcome Dr. Kamla ma'am to say a few words.
Thank you, Dr. Sushma. Dr. Jain, thank you very much for a very informative and a wonderful session, sir. We can see how important it is to promote breastfeeding. And now we are seeing a lot of training programs also coming to that effect on mother and child. We have a lot of training programs which are being done for doctors, so that the latest guidelines are known to all the practicing doctors. So if anyone wants to learn more about it, they can participate, they can learn from the training programs. And thank you very much for the other information on eShram portal and for the other conferences which are coming in line. So we all have marked it on our calendars that we need to register and enroll if we are interested in it, sir. We look forward to your OcuScapes every month to learn more about the latest updates on not only on COVID, but on other occupational health issues. I thank you very much for this wonderful session, sir. Thank you very much.
Thank you so much, Dr. Kamla. I would like to remind all the participants that the recording of today's session will be available on Enoch DigiConnect channel of YouTube shortly. Also, the slides that I presented today shall be published in the OcuClave newsletter that will be coming out tomorrow night. So you
Thank
could
thank you.
see those slides over there, and you could also watch the entire set of slides and the entire video magazine, which we have done it live today on the YouTube channel. And you can then share it amongst your friends and your workplace, your managers and your workers.
Thank you, sir. Thank you so much. I cannot see any question in the chat box. Mr. Shivans, is there any question?
Dr. Sriniket is also there. If you want
Yeah,
to say something,
Dr.
Tyagaraja,
Sriniket, sir, you are most
Dr.
welcome, sir.
Ghanshyam, they can unmute and talk. If anything else they want to share, they welcome to share. Or any comment or any questions, they are free to speak. Dr. Tyagaraja, Dr. Sriniket, and Dr. Ghanshyam, please. If not, then Dr. Sushma, I think we can conclude.
Yes, I'm not able to see any questions. So I think there's no question in the chat box. once
I
again-
also wanted to thank you. I noted one point which you had added, that there is a provision for giving leave to care for sick young children, which I didn't know that it existed. So this is a learning, sir. I think now most of the organizations should include this leave also, because till now we have got the childcare leave, parental leave. So this is a new leave which you have informed us. So I think if you could tell us, is it new or is it been there and they haven't included it?
No, that was, in fact, Government of India started following that practice because UNICEF, ILO
Yes.
were advocating, and Indian
was.
government was one of the few countries in the world which started this. And this come out in the various state governments now, very many organizations are giving with child care leave to look after sick children.
Okay,
There is a positive aspect that has come about.
that's
Yes.
very true, sir. Very true.
But we must remember we should not contain ourselves to the law. We should go beyond. And that's why I mentioned certain good practices and what is desirable also in my presentation today. And that is the global way to go about improving the practice on the ground. We should not contain ourselves to only meeting certain stipulations of the law relating to breastfeeding practices.
Yes, sir. Thank you.
I'll welcome Dr. Sandeep, sir, and I'll welcome him to say a few words. Dr. Sandeep Sharma, sir, I think.
Yeah,
he's-
thank you, Dr. Trivedi. This was really a very enlightening talk by Dr. Rajiv Jain sir. And breastfeeding is really right now is very important because of the change in the lifestyle of the working women's and the way they are now working in different corporates, and they don't find time for these noble efforts. No? So right now, what is also important is the human blood banks, and these human blood banks, these are also very important. And
Human breast milk bank.
yeah, human breast milk banks. Yeah. So I have seen so many premature babies who were like their mothers were not lactating, and they were advised by some hospitals that they should get the milk from these human breast milk banks, but they were unable to find it. So we should promote more awareness about this human breast milk banks, and ultimately they got it from Lady Harding, but from Lady Harding also they said they are giving it only for the indoor patients, those who are admitted in the hospital. So I would like to tell this, like Indian Oil, we have taken a CSR initiative, and now we are establishing this human breast milk banks across India. We have started already in Tamil Nadu, and this is a noble initiative, sir. We should all support it and make it more awareness should be there about this breastfeeding, and especially in case the lactation is not there and this premature childs, they are in need of breast milk feed, then the various blood human breast milk banks where they are available, and what is the procedure of taking these milk bottles from there and replenishing it again. So thank you very much, sir.
Thank you, Dr. Sanjeev,
So
for
one thing I just want to add in this, like sir was saying about human breast milk bank. So it is it's not a new thing. Even private hospitals are following this. And breast milk, sir is knowing about this. Breast milk bank is not a big role of human breast milk bank. Even the patient or mother can store in her own fridge. The fridge should be very clean, and she can store 24 hours of her breast milk in the room temperature, 48 hours in freeze, and even for 4 to 6 months in freezer. So it is very good for the premature babies. We are giving kangaroo care method to mother also, and she is following this even for the sick baby and preterm babies. So it is following since long back, and the private hospitals are also following this.
very true. In fact, the country's first human breast milk bank was opened in Kalavati Saran Children's Hospital, attached
Yes,
with
sir.
Lady Harding Medical College in the
Yes,
year
sir.
2007. And Fortis Hospital also is having human breast milk bank in New Delhi. And many organizations have started a very comprehensive development of human breast milk bank, because it is the safest way to look after critically ill neonates, especially neonates which are born early, before say 28 weeks also. They can survive and they can be protected from infections, and the outcome is far better than using other alternative sources. And
Yeah.
I've myself in Kalavati Saran Children's Hospital, so many mothers are donating their breast milk because they're lactating. They have the milk and they donate, and that is given to the newborn babies where the mother's milk is not sufficient. So that banking system is the best way to donate and give free.
Yeah, it needs to be more strength.
Absolutely. There is a need, and this initiative by Indian Oil Corporation is worthwhile, being emulated by other large organizations which have pan-India presence. I must commend Indian Oil for initiating this process, because Indian Oil has footprint all across the country. It is the biggest contribution to human survival and growth, especially newborns which are born below 36 weeks of life, below 32 weeks of life, even below 28 weeks of life. And they are in neonatal ICUs and critically ill. But human breast milk, which has been donated by other mothers, is the life-saving gift that any woman can give to another baby of another mother.
Sir, actually it was started in 1982.
Right now, sir, with
that's all.
Actually, it was started in 1982 by Dr. Fernando, and it was not appreciated by WHO, even Government of India. So it was taking long time, and now it came in picture.
Very true. In fact, today's to find Professor and Head of Neonatology, Dr. Sushma Nangia.
Yes,
she,
sir.
on the chapter page, you find what she's talking. There's an interview. It's worthwhile. I would commend the readers of Times of India newspaper to go to the center page and read what Professor Sushma Nangia has to say about this technique. Yes, Dr.
Sir, with this, you're playing that, sir?
I can see Dr. Tyagaraja sir is also there.
Yeah, I was saying that with more and you can start, sir.
Yes, sir. Sir, please. Dr. Tyagarajan, sir.
I think he's muted. Dr.
Okay.
Sandeep,
So,
if you want to
yeah, what I was saying, sir, with more and more of this IVF, successful IVF centers and successful in IVF across India, lot of demand of this human breast milk bank, it will crop up
Yes.
because what we are seeing that these IVF babies, either they are born premature many times, and they are twins also. So
Yes.
in that case, this breast milk bank requirement will rise, and we should make general population also more aware about this breast milk banks,
Very
and
true.
we
Yes,
should
sir.
try to facilitate this. Yeah,
Very true. Thank you for bringing this issue. And
Right,
the
sir.
companies, as a CSR initiative, must promote this noble initiative, breast
Yes.
milk bank.
Yeah.
I think now, Dr. Sushma, we could conclude today's
Yes, sir.
episode.
Yes, sir. Once again, thanks a lot, sir, and giving us lot of information and updating time to time all of us in this current scenario and pandemic. Thank you so much, sir.
Thank you for moderating so well. Your maiden initiative for moderating OQ Healthscapes. Thank you, Dr. Sushma.
Thank you, sir. Thank you so much. You are a guru.
Not at all.
Thank you, sir.
Okay.